Okay, please start.
Yes, hello, I'm Dr. Abukunda, one of the doctor in the clinic today. I might talk to Mr. Adam, the son of Mrs. Amina, 65 years old.
Yes, doctor.
Yes, Mr. Adam, we are here today to discuss some issues related to your mother condition. Is it okay with you?
Yes, correct, doctor.
Okay, before we are starting, may I know what do you know about her health condition?
Uh, doctor, what I know is that my mom, she developed a bug infection, and I think 4 months back, and then she went to GP. At that time, she was given some medication to treat the bug infection. However, she was losing weight, and then she was admitted here, and then you people and your team found that she had a cancer. And after that, your team has planned for some treatment called chemotherapy.
Yes.
Yes, but somehow
Okay.
she developed another bug infection.
Okay. I appreciate your knowledge. And do you have any expectation?
No, just I came here to collect my mom's death certificate, and I would like to know that, I mean, why it was not diagnosed before, doctor.
Yes. Before we're starting, do you need anyone to admit to join our meeting today?
No, I'm okay, doctor. I'm fine. Thank you.
Okay. First, if you let me, I will explain what happened. Is it okay with you?
Yes, doctor.
Okay, actually, Felice, I'm sorry for your loss. Please accept our condolences on
Okay.
behalf of me and my teams.
Yeah, thank you, doctor.
Yes. What was happened? Your mom, as you said, she having a loss of weight at last time, and she diagnosed with a condition called metastasis cancer with unknown primary. Do you heard about this condition before?
Yes, doctor. I mean, the team told me something like that.
Yes, and unfortunately, she already having meets to a lot of organs like her liver, her bone, and the lung.
Okay.
Okay, and right and now, because her condition is already advanced, okay, and she present with this bug infection again. She is very fragile and unable to stand against all this. What happened to her? Do
Okay.
you understand me?
Yes, doctor. I understand you.
Okay. And when we're having like this condition, metastatic cancer without unknown, we don't know what happened in her body exactly. And she may be being very weak and her immunity is being very low. So any infection like her last bug infection, it can threaten her life. And this is a cause of her death.
Okay, so doctor, if my mom had been diagnosed earlier, would it be possible for her to still be alive?
Yes, I understand from where you are come and I understand you're worried about what happened to your mom. But sometimes we having this condition is happen in a medical field. Many patients, they may come with the cancer without primary, and the symptom is not being clear at the early. So the diagnosis is being difficult because you don't have an focus organ affected to searching for any disease hidden.
Okay. All right. So, I mean, if you know that she was not like cannot be diagnosed or unknown primary, as you have said, then why you did so many tests if you know that the answer is not curable?
Yes, as our oncology planning to give her chemotherapy, but it is not sometimes uncurable because we don't know the nature of the disease.
Okay,
Okay,
but
because
you
if
already
we
said that
know.
it is a unknown primary. So my question is that if you knew that she is not curable, then why you did so many tests?
Yes, usually we need to do this test to look to searching for the primary because we don't know where is the primary and we don't know with what with which type of cancer we are deal with to select the best treatment for her. So usually this test is very important.
Okay.
Do you have any more concern?
Yes, doctor, I would like to also know that, I mean, when she had her first time a bug infection, she lived for so long, and but right now, why she didn't survive?
I'm sorry, I didn't get your.
I mean, when she had a first time bug infection 4 months before, and she was given some bug killing medication, she was able to survive for 4 months. But right now, she developed this bug infection in the chest, and she didn't survive. I mean, why is that so?
Yes, I understand you. But Mr. Adam, really, 4 months and up to now, it's a long time. So that means if already her primary cancer, if it started from that time, okay, and we didn't starting management, she being more weak. So for this reason, she unable to stand to again to defend her this infection.
So, was it a mistake from your side that you were not able to diagnose earlier, doctor, as you said that
I don't know what happened exactly at that time before 4 months
two
because
minutes
she
remaining?
didn't have a clear cancer at that time. But after that, she developed the symptoms. So I didn't think it is a mistake.
Okay. All right, doctor.
Okay. Do you have any more concern?
No, doctor. No, no more concern. I have just come to collect the report. I mean the certificate.
Okay. Regarding to the issue certificate, I'll refer you to the Corona team, and they will provide you with this certificate. May I ask you some social question?
Yes, doctor.
Anyone depend on your mother?
No, I mean she was living alone. She was independent.
Okay, and do you need any social support or anyone to be with you or to help you, any kind of help?
No, no. Thank you, doctor. Thank you so much. But I can manage.
Okay.
All right.
Mm,
So,
Still we have a
so
time.
20 seconds you have.
20. Okay. I will ask someone to drive you to home.
Okay. Thank you, doctor. Okay.
Thank you.
All right. So, what do you think how it went?
Really, this is the first time I practice communication case.
Okay.
And really, even this kind of scenario I didn't read about, I didn't hear about before. When I read it, I don't
So,
know from
this
where
case
should it.
came in a 24-second diet, okay, in
Okay.
many international centers.
Yes, but
Yes.
I feel that I don't know how I should start and where I should finish. It is difficult scenario.
Okay. No worries. We will discuss. Anyone would like to comment or any feedback what could be done better? Any opinion, please? All right. Okay. So here, uh, the patient, I mean, this is a case when the patient had a cancer or metastatic cancer of unknown origin, and somehow she died. Okay. And the son who has come here, uh, maybe he does not have idea that what actually means the metastasis. Okay. He might have
Okay.
heard that her mother developed, that she has a cancer which has metastasized or spread to the different body parts. Okay. But he
Okay.
might not be aware. Okay. So we will discuss this. So first, I mean, whenever this kind of the case we discuss, we have to be very much aware that what we are discussing, because the surrogate or the patient in the real life, they are very emotionally drained, okay, because they have lost their near and dear. So before you start, your tone, your words should be very sympathetic. You should be very sympathetic, and you should be empathized that I am really sorry for your loss. I can't imagine, or I understand that how much it's difficult time for you. So you have to be start something like with this, okay, rather than
Okay.
directly to explain that your patient has this, correct?
Okay. Yes.
Because in this kind of the scenario, there is nothing to do. We have to just repeat the things what has been given and to counsel them to address their concern. So it should be very important. Okay. So there are three
Okay.
things in any grieving relatives or needs before any information is given. Okay. You have to
Okay.
acknowledge, yes, that whatever has a loss, your loss is real and it's painful, and we acknowledge that it is a very big loss, and we understand that how much painful it is. Please accept our sincere condolences. Okay, you have to
Okay.
show them acknowledge. Then you have to tell them a simple story that what actually happened regarding her, whatever the case has been given. Suppose whether it has been end of life care, or it has been the case where she was diagnosed with cancer but it's not completely diagnosed, where the source was. Okay. And we
Okay.
have to be in very simple language without any jargon. I mean, you try to explain very beautifully, but somehow you end up with too much jargon. Correct?
Okay.
You explained that your mother has metastasis of some unknown primary. So you have to explain in a simple word that your mother was diagnosed with cancer, and the cancer was, we call it metastasis without any primary origin. It means that sometimes the cancer has spread to the different parts of the body, but we are not able to recognize or identify where the source is. Okay,
Yes, you're
correct?
right.
Because
Mhm.
this he might not able to retain what you are giving the information, because for him these all are the jargon words, or he may go home without any empty feedback. Okay, and then you have to give
Okay.
him absolution, that you have to give him assurance, because he might think that it was a failure of your team, that you were not able to diagnose or you were not able to treat, because he has asked that, was it possible for my mother to be alive if it was diagnosed before? Correct?
Yes, correct.
Yes. Because if you don't give the information that nothing was missed, okay, and here most of the candidate fail. Okay. So you have to,
Yes.
so the unknown primary, what are the communication problem it can be? Because this is a specific trap in this scenario. Okay, the source was unknown. There are some scenarios where the source has been confirmed that she has a cancer of the lung, or sometimes mesothelioma, or cancer of liver, or any some uh, like the organ which has the primary has been identified. Here, there is no identification of any primary source. Okay, and the son does not know that the cancer was unknown primary.
Yes.
Yes. So you have to say that
Yes.
sometime he asked you that, would it be able for my mother to survive? Correct?
Yes, correct.
Yeah. So you can say that yes, I completely understand your concern, and I appreciate that. But actually, at that time also, if the cancer would have been diagnosed, the outcome will be the same. Because when she came with the spreading of the cancer, at that time also, she had the lung, liver, and the bone spreading also of the cancer. Okay. But
Mm.
when she came initially 4 months before with the chest infection, it could be possible that she, or that time also, she has already presented with the spreading of the cancer. And we have diagnosed as pneumonia. Correct?
Yes.
Yeah. Why? Because it is very difficult initially to differentiate a person having a cancer or a bug infection unless the patient shows some red flag signs. What are the red flag signs? Weight loss, any loss of appetite, any tiredness, which was not given in the scenario.
Yes.
Okay. You have to
Yeah.
distinguish that the unknown cancer of unknown primary from misdiagnosed. You have to give him assurance that yes, your concern is valid, but this is not a failure. This kind of the condition, even if it would present initially, the outcome would be the same, because there was no red flag sign. And he asked that why you did so much of testing. Then that concern you were, I mean, you answered very beautifully. Okay, but and you have to tell them that yes, it was done to rule out what could be the primary source of the cancer. Because in some cases, if it would have been identified, we could have give some more appropriate treatment which would help her to cope up with her condition. But unfortunately, we could not find out, and we are very sorry for that. You are not apologizing. This is not an error. You are sorry because you are being sympathetic.
Yes.
Okay. And try to remember your communication. What I feel, the emotions and the sympathy was lacking. Okay. And this is the
Mm. Right.
thing which the examiner, they are writing it down and they are watching you. That are you empathetic? Are you able to cope up or explain the patient in a very sympathetic manner? Because he is coping up with so many emotions. Okay. So this is a
Yeah.
non-negotiable rule. Emotion before information. Every time, in any case of any breaking bad news, or any case where you have to condolence or grievance or any death case of communication. Okay, here the surrogate was not any like aggressive, or he was not escalating anything. But even if they escalate or they become angry, you acknowledge the concern, normalize it, give a pause, give a silence for some time to absorb him or to raise his concern, and then you respond. Correct?
Okay.
Suppose if
Yes.
he is very angry, then you have to calm it down, let him absorb, let him speak him, and then you reply. Okay. You have to
Okay.
give some pause. You have to be very empathetic. I'm really for your loss, sir. Okay. And then you can try. All right.
Okay.
Here, I think you should not involve the Corona, because I think Corona is a service which we offer or involve if the patient was any kind of the
Then the
case where the postmortem or any death which has suspicious circumstances. Correct?
yes, again, can you repeat?
Here, you said regarding the death certificate that I will guide you to Corona team, which will provide you death certificate. Correct? So what I feel is that to
Yes.
provide the death certificate, not in every case the Corona team provide the death certificate.
Okay.
Okay, Corona
Mm.
team is a particular team which usually has a role if the patient is going for postmortem, or if the patient is arguing for that, or if the patient has suspicious death in the hospital within 48 hours.
Okay. Okay.
All right. So better to
Okay.
avoid Corona here, and please don't use so much of jargon.
Okay. And why I should guide him for the certificate if he asking me I
Nothing our
wanted a
team
certificate?
will give. Our team will give. Simple. Keep it simple. In even it everyday hospital scenario or life, the primary
Yes.
team of the hospital or the uh, treating team will provide.
Okay.
Okay, and you have to
Yes.
give a. You took the history, but you were like there was a silence at the end. So if you have time, so use it. You have to condolence him. You have to ask about the grievance services, bereavement services. Okay, that's I can understand it's very difficult for time for you and for your family. If you need anyone to beside you or anyone to talk, we are ready to provide you the bereavement services. Correct?
Okay.
So these are the
Yeah.
things which the British examiner they mind and they mark that how you are dealing the concerns. Correct, doctor?
Okay. Okay. Thank you very much. Thank you.
Okay, all right.
And
Anyone has
the
and yes, yes, please.
the red flag is jargon, or it is okay at should tell
Red
the
flag is not completely jargon, but you can say that if the patient does not, it is very difficult for us to diagnose in the first instance if the patient does not show any symptoms or like weight loss or any tiredness. Okay.
okay. I should enumerate the symptom without tell use the red flag exactly.
Yes.
That means
Yes. Correct. And try to explain the condition in a normal language. Okay. Don't use jargon,
okay.
because if you will use the jargon, you will not get a good mark. Correct? I'll share you one of the feedback. You can get it. Just hold it. Anyone has any concern? Just
Excuse me, I have a question.
yes, please.
Yes, in any communication scenario, if I'm talking to the second person, like the son, not the patient, okay, and when I should invite another one.
Sorry, can you please repeat once more?
Yes, I mean, when I'm talking to the son, for example,
Mm-hmm.
I'm not talking to the patient. Okay. I think when I talk to the son, I want to like this scenario. I want to talk him about her losses and like this. Is it correct to ask someone to be with us to join the meeting, or this is not correct?
Yes, you can ask. You can ask because you don't know. He might is emotionally very down. It is correct to ask in this kind of the scenario.
Yes. And what other examples like this I should invite other one to join our meeting?
If like there are so many scenarios, suppose the patient you are going to break the news.
Okay,
Okay.
breaking bad
Uh,
news.
Yeah, breaking
Breaking.
bad news. But provided, suppose if the patient has a HIV, okay, this is very particular or very serious things with the person's own status. So in this kind of the case, you don't ask them to invite, or you ask them, would you like, or it's better to avoid if it is possible. If they ask, then only. But suppose the patient who has come, or you have going to breaking bad news of some condition like multiple sclerosis.
Yes.
Okay, in that kind of the situation, you can ask them that, sir or ma'am, would you like someone to be with you during our conversation, or are you okay? Can we proceed? Or suppose there was a scenario, the patient was admitted in the hospital, okay, for breathing difficulty. The test was done in the hospital. He is in the ward, and the reports diagnosed that he has a lung cancer because he was just admitted with cough. Now, in this case, you
Yes.
can ask them that before we proceed, because a 60-year-old man, you might not be sure that how much he is strong enough mentally, or any family members are involved or not. So in that case, you can also ask that, would you like anyone to be with us during the conversation, or we can proceed.
Okay, but I mean, not when I'm talking to the patient directly. I
Even
mean,
even
what
if,
I'm talking to
yeah,
person
even if
because
the attendant
uh,
also. If there is a like this scenario, if the patient has a like this, suppose this patient has a surrogate. Okay, here this is the case when the patient's near or the dear one, the surrogate who has come, the patient has already died. Correct. So
yes,
he may be
yes,
emotionally drowned. You can ask that, sir, would you like anyone beside you during the conversation? Okay. Or
yes,
suppose the patient who has a stroke, the patient is admitted in the ICU, very poor prognosis. The GCS is 3, and you are going to
mm,
say that the patient has a stroke, and now even the chances are very less. And the surrogate
okay,
is even not aware, correct? In that
yes,
scenario, also you can ask them to invite someone.
okay,
Okay. So it depends on case to case.
okay,
This is your clinical judgment. We have to take it very wisely. Okay.
okay.
Let me show
Fine.
you if I can find the feedback. So this is the kind of similar feedback. Okay. So discuss the
Okay.
concern of acute death of the relative. Okay. So here
Yeah.
there was nothing to do. Okay. So the
o-
candidate was the feedback was that he was able to explain the things clearly. Okay.
Okay.
And what is written? Can you read it?
I think it's no, it is hazy.
It is
Some
as is.
blurred.
Yeah. Appropriate explanation and sensitively offering proper condolences. Okay. He is offering proper condolences, explain the things
Yes.
clearly. Okay. And
Yes.
in the concern, medical communication, they have given full marks and just written that addresses concerns. Okay. So you
Mm.
have to very wise, and your clinical judgment should be very clear that what are the surrogate is asking for. Okay. In
Okay.
this kind of the scenario, the only marks we get complete mark is that